You're ready? Hello, everyone. I'd like to, as I begin, to acknowledge that we're gathered on the territory of the Musqueam, Tsleil-Waututh, and Squamish peoples. As you know, I'm Mike Farnworth, the Minister of Public Safety and Minister responsible for Emergency Management, British Columbia. For the last several weeks, Provincial Health Officer Dr. Bonnie Henry and Minister of Health Adrian Dix have been working tirelessly to prevent the spread of COVID-19. Dr. Henry has given us important instructions on how we can flatten the curve and keep people safe and healthy. Yesterday's declaration of a public health emergency facilitates even faster response to this rapidly evolving situation and gives our public health officer the ability to make swift decisions to protect British Columbians. COVID-19 is impacting all of us, touching our lives and our economy. And I know it's been hard on people. I want to assure British Columbians that our government is doing everything possible to mitigate the risk for people in our province. But we are facing daily, shifting challenges, as is everyone in this difficult time. At this juncture, we need to ensure that we will continue to have the means to coordinate our response across government, across industry, and that we have the tools available to protect the most vulnerable. That is why, today, based on the recommendations of BC's health and emergency management officials, and following Dr. Bonnie Henry's declaration of a public health emergency, I am declaring a provincial state of emergency to support our provincial health officer and Minister of Health in swift and powerful response to the COVID-19 pandemic. This declaration will make sure federal, provincial, and local resources are delivered in a joint, coordinated way to protect the people of our province. This is an all-hands-on-deck approach. The declaration also includes the means to secure critical supply chains, to ensure people have access to essential goods and services, and that any infrastructure necessary to support the response to COVID-19 is readily available. Yesterday, you heard the Premier and Minister of Finance outline our plan to support people and to protect workers. As House Leader, I'm working to resume the Legislature to complete this urgent government business to expedite our response to COVID-19 and the key decisions that will need to be made in the coming days to give immediate relief to the people and businesses in our province. I want to take this opportunity to thank Opposition House Leader Mary Polak and Green Party House Leader Sonia Furstenau for their cooperation. Together, we have agreed to resume the Legislature on Monday with a reduced number of members to pass important legislation that will ensure the continuity of government and provide important employment supports to people in our province. Our government will do whatever is necessary to protect and support British Columbians and communities, and we will use any and all resources available to keep people safe. These are extraordinary times, and I want to acknowledge and express sincere appreciation for the efforts of all involved in this emergency. To the essential service workers, to the health professionals, to the grocery clerks who continue to support us all. As Dr. Henry has said, now is the time to be kind, be calm, and most of all, to be safe. We all have a role in protecting public safety in our communities. Provincial states of emergency were previously declared in 2017 and 2018 in response to wildfires. The way communities came together during those events was nothing short of extraordinary. We're now asking all people in this province for their support again. Follow the advice of the public health officer. Be vigilant about your hand hygiene. Maintain social or physical distancing and stay home if you're sick. We are going to get through this together, all of us. Thank you.
Thank you, Minister. We'll now take questions, and we'll only take one question at one time. We'll take questions from the room first and then go to the phones. My colleague Johan has a microphone. Please do speak into it. The first question from the room, Frank, Omni Regional.
So, Minister, what does it mean for state of emergency in the province? And what kind of measures will that also include measures of tightened control at the border?
So Dealing with that last bit first, the measures of control at the border were announced today by the federal government. We are very pleased with the decisions that were made. They clearly have to listen to British Columbia in that regard. What today's declaration allows is for a province-wide approach to back up the provincial health declaration, emergency declaration that was made yesterday by Dr. Bonnie Henry. The act that governs that public health emergency was declared yesterday has considerable powers in it, but the emergency declared today under the Public Emergency Act allows for additional powers, particularly in areas such as supply chains, for example.
Any other questions from the room here? Frank, we'll come back to you. We'll need to take more questions from the room at this time. Any questions from the room? We'll now go over to the phones. First questions over the phone from Lisa Yudza, followed by Gordon Armstrong and Richard Zussman. Lisa, go ahead. Hello?
Regarding self-isolation.
Yes, go ahead, Lisa. What's your question?
Hello?
Yes, we can hear you. Can you go ahead, please? Can we move on to Gordon Armstrong now? Gordon, go ahead.
Hi. Question about what you're doing about hoarding, people hoarding groceries, toilet paper, and evidently now liquor. Can anything be done to control that situation?
Yeah, no, that's an excellent question, and I understand people's concerns about wanting to make sure that they have enough supplies at home if they have to self-isolate. But the reality is this: our supply chains are in good shape. People need to use common sense. We are working both at the federal and the provincial level with the Retail Council. Many stores and chains are in fact now putting in place limits in response to what has been seen, and we're encouraged by that. The declaration that has been put in place today will give additional powers, if necessary, to back up the work that is taking place, not only just with Dr. Bonnie Henry and the provincial health directives that both she and Minister Dix are putting out, but also the work that's being done, as I said, at the provincial and federal levels with the Retail Council, for example, to deal with this issue.
Thank you. Next question, Lisa.
Can you hear me now?
Yes. Please go ahead.
I'm going to try doing it this way. Can you guys hear me?
Yes, we can hear you, Lisa. Just go ahead with your question.
Thank you. I'm wanting to know if the powers that this gives you also include, and how it would include, enforcing the orders that people self-isolate for people who are not willing to do that. There's a lot of concerns that people are just going to throw caution to the wind.
First off, many of those powers are actually contained under the Public Health Act. Dr. Bonnie Henry has considerable powers in those particular areas, including being able to direct police to enforce orders. What we want to do is work and make people know there's the right thing to do. And that, you know, coming back with, if you're feeling ill, if you're feeling that you've got the symptoms, then the right thing to do is to self-isolate. And that's the approach that is being taken. But as I said, you know, there are powers available under the public health emergency that's been declared to ensure that if people are flagrantly, you know, abusing or not following those instructions, that they can be made to.
Thank you. Next question, Richard Zussman.
Minister Farnworth, one of the notes here in the legislation around a state of emergency is giving you the power to force people who are qualified to provide work. So do you expect that this will be something you could potentially use to require retired doctors or such, or former medical officials to be brought back into the medical workforce?
As I said at the beginning, the introduction of or the declaration of this emergency situation does give us broad and sweeping powers to be able to direct resources, whether they are human resources or other resources, to deal with this state of emergency that we have in the province. But I can tell you, what we're seeing is what we see every time that we've had a disaster in this province: people stepping up and coming forward. That's what we do in this province. I do not believe that I'm going to have to use a power to force people to do what they instinctively know is the right thing to do. We are seeing every day, and we're fielding inquiries both within my ministry and in other ministries, and especially in the health ministry, of retired health professionals who know that they have skills that they want to assist, and in coming forward to do just that. So I'm not anticipating having to use those powers. They are there, but you know what? British Columbians are doing the right thing already in that regard.
Thank you. Next question, Moira Witten. Moira, are you there?
Hi, Minister. Thank you for your time. I'm here. I'm asking about the powers that, in conjunction with Dr. Henry's public health emergency declared yesterday, what are you, have you had issues with people not self-isolating? Are there any reports there?
To date, what we are seeing is that people are doing the right thing, but we know that there are always those who choose not to, it's a big province. What we want to ensure is that, as was declared yesterday with the public health emergency, the state of emergency will allow additional powers, if they're required, to back up the powers that Dr. Bonnie Henry and the Ministry of Health have. In our case, the legislation I'm responsible for, they are additional powers, and if necessary, they can be exercised. But the key thing right now is to ensure that we're ready, that we have the ability to deal with situations that they occur, and that we are in discussion with Dr. Henry on all these matters, and right now what we're seeing is that the directives that she is putting in place are being followed.
Next question, Keith Baldry.
Hi there, Minister. You hear me?
Yeah.
Hello.
Yeah, we can hear you.
Yeah, so again, back to the powers outlined in the Emergency Program Act, they're pretty specific. One of them, a number of them reference you'll have the power to potentially ration food, set the price for food and gas. Can you envision yourself actually having to take those steps?
I can tell you right now that our supply chains are in good shape. As I've said, we have been working with the federal government. I can tell you, I just got off a call before this press conference with Minister Blair and my colleagues from across the country, and that the supply chains are in good shape. We've been, as I said, working with the Retail Council and retailers to ensure that we are able to identify and deal with issues. As I said right at the beginning, these are extraordinary powers that can be brought to bear in extraordinary situations. But as I said, our supply chains are working. We're getting good cooperation. I'm pleased with the cooperation that we're seeing, and that's what I expect to continue.
Next question is from Les Lane, followed by Rob Shaw. Les, go ahead.
Well, Minister, do you have any reports on your desk or any personal sense about the state of law enforcement in BC and the crime rate in general? What's going on there? Is the law enforcement community mobilized, or are they kind of curtailed like everybody else is?
No, law enforcement is mobilized in the same way that every other sector is. They are doing their job, enforcing the law on a day-to-day, or just as they always do. I can tell you that my Director of Police Services has been in regular contact with detachments around the province to get an understanding of the impact in terms of if COVID-19 is having an effect, and as well as preparations that are required and any issues that come up. So we are, as I said, having daily communication on that, and I'm really pleased with the job that they're doing.
Thank you. Rob, go ahead.
Oh, hi, Minister. Can you just tell us, you're recalling the legislature, I think, to pass legislation to protect people from being laid off if they're calling sick during this pandemic, and I guess interim supply, so the government has money. Can you just outline what that legislation is and how this brief session is going to go?
Yeah, so we will be coming back on Monday. It will be based on a quorum of about 12 members in the House. There will be a speaker in the chair. There will be 2 members of the opposition. There will be 2 members from the Green Party, and then the balance will be from the government. We've worked very cooperatively in terms of being able to deal with 2 pieces of legislation, one of which will be a Supply Act, which will allow government to function, and the other will be amendments to the Employment Standards Act, which will deal with some of the issues that you've talked about. And I know my colleague, Carol James, the finance minister, will be making more details on those later on. But my expectation is that they will be dealt with expeditiously, and that there will be debate and discussion on them. But I'm very pleased with the cooperation that we have had from both the opposition and the Green Party in recognizing the importance of this situation. I can also tell you, in terms of the legislative building itself, there will be a minimal staff presence, that we will be maintaining social distance while we're there, even in the chamber.
Binder Sajan, go ahead, please.
Hi, Minister. I just wanted to know, on behalf of the BC government, if you can respond to the package announced by the federal government today.
Yeah, what I can tell you is that, as I said, I was on the phone with Minister Blair and my provincial counterparts from across the country. I am very pleased with what I've heard today on a number of fronts, both clearly in terms of the border. Ottawa has listened to BC's concerns, and that the closing of the border to all but essential border crossings and the ability to allow commercial crossings to continue, I think, is extremely important to us here in British Columbia. And that the financial measures that I've heard about, and I'm obviously going to wait further details over the coming days, are significant and will certainly help British Columbians, and will build on the work that we will be doing here in British Columbia.
Thank you. The next question over the phone is from Eva, CBC Vancouver, followed by Amy Smart and Tanya Fletcher. Eva, go ahead, please.
Hi, yes. I wanted to ask, in terms of people gathering, how are you going to police or advise people who are going ahead with weddings that traditionally see 500 people at the ceremony and always with overseas guests?
The provincial health officer has already made decisions around that, and the gatherings of 50 people and social distance applies to weddings, and so people need to be mindful of that. We saw yesterday, for example, that there were many pubs, restaurants, and public occasions that were wanting to celebrate St. Patrick's Day. They had to cancel.
Amy, go ahead.
Hi, Minister. I've spoken with fire chiefs in various districts who are changing their service models. They're starting to triage their calls and not respond to the the least serious medical calls. RCMP are closing some of their counter service. I'm wondering if you're giving any direction from the provincial level to first responders, or if you're leaving it up to each office to make their own decisions.
First off, there's a number of issues that are dealt with. One are the directives that are made by Dr. Bonnie Henry and the Ministry of Health in terms of how to approach these situations, and what to do when COVID-19, if exposure or confirmation has been detected, or people are feeling ill and sick. And then, of course, they will make local decisions based on the size of the detachment and the scheduling and the situations in their particular location.
Next question, Tanya Fletcher. Go ahead, please.
Next question, Tanya Fletcher.
Hi, Minister. Further to Monday's proposed changes to the Employment Standards Act, can you further explain or maybe explicitly clarify for people what BC is able to do? Like, for example, with financial aid, Carol James said that largely depends on what the feds are doing with their aid package. But for these changes to the Employment Standards Act, what capabilities does BC have to protect workers, and how will that look under those changes?
Okay. So what I can tell you is that the ministry, the finance ministry, will be able to speak to those later. What I can tell you right now is that there will be legislation introduced, and the details will be unveiled at that time.
Thank you. Next question. McLean, go ahead, please.
Hi, Minister. I realize much of this would be out of your control, but how long do you anticipate the sitting next week will need to go?
Well, what I can tell you is that I am hopeful that we will be able to get things done in a single day. That's why I've worked closely with my colleagues in both the BC Liberals and the Green Party on a session coming together. And as I said, I've been very pleased with the cooperation that we've had. We all recognize that this is about British Columbians. This is not about partisan differences or games of one-upmanship. We have worked very well together, and so I expect that we will be dealing things in a business-like manner, that they will be asking the questions, on the legislation. We'll be answering the questions, and our goal is to get it done as quickly as we can.
Thank you. Next question is from Albert, Fairchild TV. Go ahead, please.
Minister, we see people selling groceries, whether in online or at the car trunk. So, and also the grocery stores will mark up the price of some necessity items. So, what law enforcement is available to deal with that?
I'll make a couple of points on this. There is no place for price gouging. There is no place for anybody, either individuals or retailers, taking advantage of what is an unprecedented health situation in this province, in this country, and globally. It is important that we recognize that we are all in this together, and that by making products unavailable to people through price or by hoarding does not help anybody. In fact, it has the potential to really hurt people. We know in our own neighborhoods that there are people who can't get out, there are seniors who need help, and British Columbians are stepping up to do that. And so we will be watching and very carefully. The Retail Council has made it clear that they do not expect any of their members to engage in those kinds of activities. One of the things that I can tell you that the powers that become available under today's declaration, for example, prohibit the selling of necessary supplies, medical supplies, reselling them. So we take this issue very, very seriously.
Bob Mackin, go ahead, please.
Hello, Urian. The health system has recalled retired nurses, retired doctors. Might you do the same thing for the emergency services system? We recall recently retired police officers, firefighters, ambulance paramedics, and others, maybe even corrections officers. Are you looking at that as well?
Absolutely, and in fact, we're already receiving inquiries from retired first responders, and in all those areas that you just mentioned, who understand that they bring a skill set that we need at this time. And as I said, that's an example of how British Columbians are stepping up. That's an example of community coming together, and that's why I am confident that British Columbians will continue to do the right thing.
And the last question from the phones from Mary Griffin. Go ahead, please.
Oh, hi, Minister. Last night, Dr. Richard Stanwyck, he's the Chief Medical Officer for Island Health, said the expectation is that this can go on for 4 to 6 months. I'd just like to know, how long is the provincial government making preparations for the duration of this? And just in terms of, we have a large percentage of renters. When can we expect any protection for renters?
On your last question, government is seized of that issue, and so work is being done in that area. In terms of how long is government prepared for, as long as it takes. We are going to get through this. British Columbians and Canadians are going to get through this, and we're all working together to make that happen. This particular state of emergency is for 2 weeks, and then can be renewed by cabinet order. And we are going to be there for the long haul, as long as it takes.
Thank you. We'll come back to the room now for one last question. Frank, go ahead.
It's a follow-up. How are you going to, say, redeploy the emergency services under your control in order to go through this time of state of emergency? What will be the major areas that you will be looking for those first responders to coping with?
Well, first and foremost, decisions are made by the Ministry of Health and Dr. Bonnie Henry. So they have significant powers already. The powers we are coming into force today are additional ones that back up that work that's being done. So what happens is assessments are done, and if decisions need to be made, then those decisions are made. As I said, we're seeing people stepping up, wanting to come out of retirement to help. All of those things are already going into the system. Emergency operations are already in place that will allow that to happen. So the plan is proceeding as it's supposed to.
That was the last question. That's a wrap up. Thank you very much all for participating.
Thank you.